Welcome to the Movement Upgraded podcast. I'm your host, Dr. Jen Hosler, licensed physical therapist and certified strength and mobility coach. Here you can expect to hear about all things movement. The Movement Upgraded podcast is a blend of the science of strength training, rehab, and mobility, mixed with the personal and professional experience to provide you with the steps you need to keep your body pain-free and moving well, so you can do what you love forever. Welcome back to the Movement Upgraded podcast. Dr. Ryan is back again to join us in talking about the low back. So say hi, Ryan.
Hey, I'm back.
I never know what he's going to do when we come on this podcast, and I'm just really glad that you guys get to see the Ryan that I know, because not everybody does, and then they think that Ryan's like this very quiet, reserved guy, and he definitely is, but until you get to know him, and then next thing you know, he's like singing Smelly Cat all the time in the kitchen. And
oh my gosh.
that actually does happen. So anyways, we're going to talk about low back stuff today. And this is important because I think low back pain is the number one cause of disability in the world. And I think it's the number one thing that we see in our office. We both have had experience with it ourselves. Most adults are going to experience it at some point in their lives. And I really don't like the way that general healthcare kind of treats low back pain, honestly. Mm-hmm. We're in the middle of an opioid epidemic, like a problem where we prescribe medications for an issue that we very well know responds very well to education and exercise. Those are the two biggest things for low back pain. Yet people will go to their medical doctors and be given medication, maybe just told to take NSAIDs, but sometimes more than that, given a shot and maybe sent to get images. And none of that is evidence-based. Evidence-based just means what the research recommends, because those things actually show the people who go there first and have those types of responses, they have worse outcomes. Because that really reinforces that biomedical model that if you have pain, it's because something's wrong in your body, and here is a medication to numb the pain instead of tackle the root problem, which is likely that you're not addressing your spine, which is kind of the other thing that I like to talk about too.
Yeah, or all of the other life factors like stress.
Right. Stress, lack of sleep, diet, your social connections, all of those things matter. And so instead of educating somebody about their pain and talking about that, which honestly medical doctors don't know how to do and don't have time to do. So this is not me just like shitting on medical doctors. Like, it's not entirely their fault. It's a whole system problem. Yep. And ultimately what I would love to see is people going to their physical therapist like right off the bat, because the physical therapist can tell you, hey, this is more serious, let's get something figured out, if there is something more serious.
It's 2022. It's crazy that people aren't educated or even know that it's an option to walk straight into a PT's office or straight into a chiropractor's office to get help. I think also some PT clinics really reinforce this, which I'm looking at the one that I had originally worked at. They were not about that, and it's really frustrating because I'm not going to go on the soapbox, to be honest, but I wish that we could do a little bit more of that, though, because when people go in and they're given these medications, so if they're given medications, now we're not addressing anything, and then they can become addicted to meds, which is really problematic. They're not given any tool to help themselves, because if you've had low back pain once, you're more likely to have it again, and if you have it again, you need to have tools to manage it. And I think one of my favorite things I do with my clients is show them things and give them tools that they, even if life happens and they don't do the things that they don't do their cars, they don't do their breath work, they don't do the things that I show them, they always have that option to go back to. And I want them to have those tools so they don't need to continue to need me, or when they do need me, they've already tried all of the other tools that I've given them, and now we can really hone in on the time that we have together. Mm-hmm. And that's one of the favorite things that I do. But if we are just giving medication, we can't do that. And then if we're giving an MRI, then we're getting people attached to this diagnosis. And MRIs are scary, I know. I didn't have an MRI for my back, but I had an X-ray. And it was terrifying to see it and hear them talk about my back. It really made me feel fragile. And if you already have pain, you're already feeling fragile. You already are worried about things. You're worried because your spine is so
it's not delicate, but it feels very intricate for you. So like if there's something wrong with your spine, it's a lot different than if something's wrong with your elbow. You're kind of like, oh, my elbow, whatever, but like...
Yeah, for some reason we just hold the spine to like a different standard. Yeah, but like it's a joint.
I kind of understand it because if you think about it, like your spine just feels, for rightly so, that's where our spinal cord is. It's kind of like we have this overprotective sense in us, but when it comes to treating it as clinicians, like I think it's funny that we are so obsessed with
come up with like the spine has like its own rules. Like we do things differently, but like it's still a joint, and we should still treat it like every other joint.
And everybody's like, oh, if your back moves, or if your back hurts, just don't move it. And then when your elbow hurts, it's like, movement keeps it healthy. Make sure we're moving it. I don't know why we have that disconnect, but...
And for you that think that I just said that your spine is a joint, I do understand that it's made up of a lot of joints.
Yeah.
Let me clarify that.
So, all of that to be said, this is why we wanted to come on and talk about the spine today, especially the low back, because the low back is very specific, because that's where people tend to have a lot more issues. Yep. And it's what we see a lot in our office. And I really wish that we would start thinking about our spines earlier on, which is kind of another thing that I wanted to bring up. It's just an afterthought.
I wish we were thinking and prioritizing all of our joints.
That's true. But like you think about it when you go to the fitness, like into fitness, what are you thinking about? Oh, I want to get my pecs bigger, and my biceps.
Nobody thinks of their shoulder.
Exactly.
You know? Yeah.
Well, that's true.
Yeah. We just need to prioritize our joints above all else, and then do fitness on top of that. Because if you prioritize your joints, fitness is going to be easier. You're going to be better at fitness.
Yes.
That's the biggest thing. But yeah, moving forward with this podcast, I think Jen talked about like how pain is multifactorial and stress can affect it, your nutrition can affect it, your social factors can affect it. We'll definitely be focusing mainly on movement and mobility stuff related to the lower back in this episode, at least.
Yeah, that is something that we like to always highlight, that it's part of the solution, and sometimes it is like overemphasized in how important it is. I will tell you, as like movement is my favorite thing ever, but I don't always focus on that the most, and I'm not prioritizing it the most. And sometimes I'll talk with people in their hour sessions for 45 minutes and we don't do any movement. Yep. And that's what they need, because we have to address that. So I just want you to realize that as we go in, and I'm really glad that Ryan brought that up, because we'll talk about this stuff, but like that doesn't mean that's what we're prioritizing. It's just everything else I've already had podcasts on, right? So today gets to be about the movement with the spine. And most of the time, what we like to think about with spine issues is like, I would say like a very common thing that happens is, one, we don't really move our spines in their full ranges of motion. We don't even think about addressing our spines. It's kind of like an afterthought until one day, like we get older and we're trying to do something really like normal, like pick up a shoe or pick up our child off the ground or grab a dog food bag out of the car, and we like quote unquote blow our backs out. This even happens with people who just finished deadlifting a ton of weight and they go to put the weight back, and all of a sudden they quote unquote blow their back out, or they injure their back, or it hurts. And I feel like it's really important to note that most of what we think about with spines and how we train them is quote unquote neutral. Mm-hmm. And we don't expose our spines to full ranges of motion. And if we don't do that, one, we're going to lose those ranges of motion. So now neutral, there's no longer a neutral, because neutral is the idea of between two extremes. And if you lose the extremes, you don't have anything but a small amount of extremes, and that's what your neutral is. So now neutral becomes an extreme for you. So that's a problem, because if we're not exposing our tissues to those ranges of motion and introducing load to them, our tissues are getting weaker as we get older. And that puts us at risk for injuries, because injuries happen when tissue load, the load that's on your tissues, on your muscles, on your back, on your body, is greater than that tissue's capacity, or the ability of those tissues to absorb and dissipate force. And so when that happens, we get an injury. And if we are slowly losing the tissue capacity, then it's going to take less and less forces as we get older to injure it. So I feel like a lot of what happens is we just stop moving our spines.
Chronically underload and undertrain our spine. And then overuse it that one time, and bam.
So a lot of times it's the chronic underloading and then an acute spike in load. Mm-hmm. So Sometimes it's like one really big load where you're just lifting super heavy in a weird position that you're not used to because you haven't trained and you haven't even exposed your body to in like years. Or it's an accumulation of a lot of small loads gradually that accumulate over like days, weeks, months until you reach the final breaking point when your back is like, yo, I am not prepared for this.
Mm-hmm. I needed some time to rest and recover.
That's exactly what your brain is saying, by the way. It's
yo.
just like that. Everybody's brain's like, yo. That's how I interpret pain signals. But that's usually what happens. And what people typically will do then is say, oh, that movement was bad. I didn't have good mechanics, and now I'm afraid of that movement, or I need to just lift with better mechanics. I need to learn neutral. And clinicians will reinforce this, again, not because they want to harm you or give you bad information. It's just the best that they can think about. And sometimes temporarily, making sure we have different lifting mechanics will feel better because you'll be able to lift without pain while you're recovering. But it's really important to understand that just changing your lifting mechanics and your posture and how you do a movement isn't injury mitigation. It's going to actually perpetuate the issue because life's going to put you in weird positions. You're going to have to do weird things. And also, every time you do a movement, you're doing it a little bit different. Mm-hmm. And that's beneficial for you. So the idea isn't to have this perfect lifting posture all the time and now change your mechanics. It's actually, let's start moving your spine and let's start training your spine to get ranges of motion and control back that maybe you've lost. And let's start loading it so it's prepared for the daily life things that you have. And let's make sure that you think about things that you want to do. If you are 40 or 50 and you want to go join a new fitness program, or you want to go join like a rec league, like soccer or something, your body, if you have not been training and doing those things for a while and you have not been preparing your body, is not prepared for an acute spike in a sports load or a fitness amount, like a load. So it's really important to progressively overload your body and join those things very slowly. And then also maybe even do a small training block where you're preparing your body before you even go into that. So let's talk about what that might look like with the spine and kind of how we do that. Mm-hmm. So you want to talk about where you normally start with assessing like somebody's low back?
I don't even think at this point it should be a surprise for anybody, but here we are again. And we always start with cars. We just assess spine cars. We want to see how you're able to move your spine.
That's just because all cars are just looking at the joint and every movement that is possible at that joint. Like it's like, sometimes I'm like, cars. And I used to be so annoyed at cars, but like the idea of cars is every movement at the joint. What else do you want from an assessment?
Yeah. So we want to see, are you even able to move your lower back when you want to move your low back? We want to see, are you able to access your upper back when you're supposed to be able to access and move your upper back? That's literally where we need to start. Yeah. It's as simple as that.
So we'll look at like full cars, which will be putting your spine through flexion, rotation, side bending, extension, all of those things. And we want to look at, can you move those things, right? And is everybody doing their part in the movement? Because when you go to move your back, let's say maybe you're going into a full spine flexion. So you're rounding your back to reach over and tie your shoes or something, or like touch the ground. Then everybody in that spine should be flexing. A lot of times over years, based off of what we're doing and how we live our lives, we might lose those ranges of motion. And now suddenly 1 or 2 segments is doing the job of like your whole back.
Yeah, and you have 24 vertebrae in your back. You have 7 in your neck, 12 in your upper back, 5, usually 5 in your lower back. And if only a couple of those joints are doing the job of like what 24 should be sharing, it's no wonder that those couple that are doing everything can become aggravated.
Yeah, I mean, I always explain movement in your spine, movement in general, as a group effort. It's a group project. If you've ever been in those pesky group projects where you do all of the work because there are like the rest of your 5 group members are just super lazy, or they just don't care because they know if they slack off, somebody else will do it. That's kind of how our bodies are. So like if you have a couple segments that are not joining forces and trying to dissipate the force or produce the movement, now all the load is going through one or two segments instead of dispersed through multiple. And so that means more load is going through those two segments. And load isn't bad, but if those ones are always doing the movement and never getting rest, it's like makes sense that they would start to become aggravated and become injured and have problems and become cranky.
And
I would become cranky. I become cranky in a group project and people aren't doing that.
And it's not just the joints that are doing too much movement. It's the joints that aren't moving, because what if you put yourself in a position that has a little bit extra load and those joints then do decide to move, but you have no control of those joints. You have no strength or no awareness of those joints.
Then you're not dissipating the forces through your muscles, and maybe they're going through your passive structures like your joints.
Yep.
Which are usually the things that get injured.
Or just the muscles themselves aren't prepared for that
because they're not strong enough.
Because they're not strong. And then you can have that injury.
And you haven't loaded them, so their tissue capacity is low. So now the load going through them is really high before they've ever been prepared for it. So
do your cars.
So cars is where we start with assessing people for sure. And what we just kind of explained is like the full spine cars. We'll always do that. And then the second thing that we always do is break the spine cars down into, I still will call these spine cars, but really it's quadruped like spine segmentation. And I'll assess spine segmentation in quadruped, but it can be in any position really. Yeah. It's just, can you isolate flexion and extension in your spine segments? Can we do that? And we break that down because in your spine, that is the capsular tissue, is the ability to flex and extend. You need to restore that before you start to restore side bending or rotation. And for some reason, the fitness industry kind of like doesn't understand that and is obsessed with like thoracic rotation as this thing that we need to do all the time.
Anatomy, arthrokinematics, it doesn't matter. No. We do what we want in fitness.
I don't know. So it's silly, but like if you are limited in thoracic rotation, you need to restore thoracic flexion and extension before you even consider that. And we won't even go to the details of why. It's just like the way that our spine moves and the way the joints articulate. So make sure that you're prioritizing those. That's what we do. So we always start there. And that is really going to be where we kind of spend most of our time with our clients, because that's where most people really struggle, and a little bit of improvement in those areas have a massive ROI for how people feel and the ability of things they're able to do. So we always just see unloaded, which quadruped's kind of unloaded. Can you segment one segment, like there's 24 of them in your back, can you move them isolated one at a time? And most people cannot. This is like, think about doing a cat-cow. That's usually what I tell people. Can you do a cat-cow? They'll be like, yes. They'll show me. And I'll be like, great. We're never doing it like that again, because you're pretending now that your spine's one segment. You're just thinking about it as one segment. And if you do them, I'm proud of you, because you are already doing something that's including your spine, which is more than like probably 75% of people in fitness that do any movement. So that's awesome. You are already one step ahead. Now let's make it even better.
Let's level up.
Yeah. Let's upgrade.
Ooh.
So
upgrade your movement.
Yes. So usually if you're doing that though, you're thinking about just one segment. And so I'll tell people, let's think about three: a lower, a mid, and an upper back. And that's usually what I'll walk people through. But my ultimate goal is, can we get every segment moving? And we'll start to isolate. But usually we have to start with where they are. And most people have no idea what flexion is. And as I start to say, let's tuck your tailbone, they're like, what the hell are you talking about? And there's a lot of coaching involved. And I promise you, like, I've worked with people for 2 years now, and I will still coach them through spine cars, and we'll still get more out of it, and we're still improving. So it's kind of one of those lifelong journeys.
I mean, when you give me tactile feedback, or when you're tapping along my spine when I'm doing spine cars, it's like, oh my gosh, I'm still getting so much more out of this than when I do it on my own.
Yeah.
So everybody can still improve.
Except me. Mine are really good.
Yeah, yours are good, but you say the same exact thing. Everybody benefits from having a little bit of that external feedback and coaching.
And spine cars and spine stuff is really hard to improve, because when you're moving, you don't have visual feedback. So all you're relying on is your proprioception and like some kinesthetic sense of like some stretching and things like that, but you can't see. But when you're doing like wrist cars or ankle cars, you can visually see and get that feedback. Oh, I see my forearm moving instead of my wrist. So I can like automatically like create that adjustment, which is just gonna help you improve way faster. Versus if you're doing spine cars, usually you can't do that. Sometimes you can kind of look in the mirror when you're doing them, and those have been one of the best things for me. Or I'll have people like record themselves, but it's so delayed that you're not able to make that connection as quickly, so it just takes longer. And I just want you to expect that. And if you are taking forever to see your progress, it's not you. It's just the way that the spine is, because we have less feedback and ability to make quick connections and improvements with those. So that's what we're doing first. And then we want to make sure, can you flex enough? Like, does your back round enough?
That's where I was just going to go. Okay. Kind of. It's like, if you've been working on spine cars for the longest time and you're not seeing improvement, I mean, within your control is one thing, but if you're just not able to get rounding in your lower back, then you might need some stretching of the lower back. Mm-hmm. Believe it or not, like, you might have to stretch your low back. I know some people will like demonize like stretching your lower back and like stretching your spine like all together, but if you can't move it, how are you ever going to be able to move it if you don't stretch to open things up and create that option to move? The
key here is that we don't throw somebody into a stretch automatically.
Yeah.
Because most people have not exposed their spines to, quote unquote, their extremes. Even if it's not a full range of motion, if it's not enough, they still probably don't go into that extreme and control it very often. So controlling what they own is usually my first priority, just to get awareness.
I would agree with that 100%.
Yeah, because also if you don't have awareness, when you go into a stretch, you're not going to know how to facilitate the stretch to feel things where you need to feel. You have to have a really good sense of body IQ or body awareness, which is why we always start with things like cars and control and things like that, because most people, if I try to start with stretches, they'll just end up loading areas that already move really well.
Yes.
So that's not helpful.
I totally agree with that.
Yeah.
We're on the same page there.
So then we go into the stretching, maybe we just need to work on like strength training. Mm-hmm. Obviously our assessment's going to dictate that, right? We're going to kind of work on some things, but eventually you should be progressively overloading your spine, which means maybe you start on hands and knees, you get some great awareness, and you're in quadruped, but like that's really reduced load on your back. So maybe you're going to start doing them seated or standing, just without any weight. And that's where we start to load it so that your spine is getting stronger. Like, you're already loading your spine in standing, because walking and moving and bending over and picking things up, that's loading your spine.
Mm-hmm.
But eventually we want to maybe add some weight with it, because you're adding weight onto your body already. So adding like an amount of tissue capacity or like a buffer where we strength train those tissues is really important. So we're talking like weeks to months to years, by the way, of adaptations of people working through these things. So I think that I started doing segmentation for a good year before I ever tried to do anything else. And then it was a year of like really slow progressive overload with just my body weight, just in different positions with gravity. And then maybe starting to add a 10 or 15 pound dumbbell for like Jefferson curls or something like that. And that's how slow you want to progressively overload, depending on who you are. So if you're somebody who has never trained their spine, you need to just get some awareness and make sure we get control. And then we need to make sure that we gain the options back that we need for whatever it is that you like to do.
Mm-hmm. Yeah, I mean, I love that like the Jefferson curl exercise is becoming like more of a thing, but don't just jump into that. Like not most people, but a lot of people they will skip what Jen just said, the years of spine cars, spine segmentation, progressive overload, and they'll just jump right into a Jefferson curl. Maybe they don't injure themselves right then, but it could perpetuate issues down the road if they're not prepared for it.
Yeah, and I mean, strength training is adding load to your body to tell it to make stronger tissues, right? So when you're adding load, then you're telling your body to get stronger. Your body basically makes those adaptations because It's like, well, next time I want to be better at this. So if we're going to do this a lot, I just need to be stronger and make sure that I'm able to do this, because we're actually creating like micro damage in our not in our joints, but kind of in our muscles, in our tendons, in the tissues. So we're creating little micro tears, and those micro tears are what kind of facilitate some of the soreness. And then our body's like, crap, I need to be stronger if we're going to, we just repair ourselves stronger. Our bodies do that in response to stress, which is what makes them so freaking cool. That's how we adapt.
We tear shit down and build shit back up.
But the important thing is to make sure that we're not tearing it down so much that we can't repair it. And that is where load management comes in, and making sure that we're not jumping into an acute increase in load, which is when we are at highest risk for injury, and we are repairing or recovering really well. So if you're going to load your spine, please make sure you're sleeping well. If you're going to load your spine, please make sure you're eating enough protein, eating enough calories in general, and please make sure we are not jumping in a spike in load, and we're not just doing 100 Jefferson curls. Even 100 Jefferson curls at like a 20-pound weight it's different, but it's a similar load as like a 100-pound Jefferson curl. That's probably not the same math, but I think you get the gist.
Yeah, we understand the premise,
We know that math is not my forte.
Gains happen in recovery.
Yeah, and there's no like perfect way to progress this. I think sometimes that's what's hard about movement is they're like, I'll get people talking to me and they'll be like, okay, well, show me the progression that you did. Or, okay, what exactly do I need to follow? And like, the honest truth is it's different for everybody, because if you're 45, you've never loaded your spine, you're probably it's going to take you a while. Or if you have like a really significant lack of mobility, of flexibility, like passive range of motion, it's going to take you a while. Yeah. But if you're somebody who's like more hypermobile and you already have lots of mobility, strength training might not take you as long. Or if you're somebody with hypermobility and you're you're in the EDS type of hypermobility spectrum, it may take you longer, because now we have to progress way slower. Or you're hypersensitive, which is kind of how I am. And a lot of people are on that more hypermobile end of the spectrum. You have to progress things slower. So it just really varies. And I know that's not the answer people want, but like where we start with everybody is just start where you are. And from there, just see how things go and see how your body's responding. And do you feel like everything's more tight and stiff? Do you feel pain in general? Like, honestly, with spine working stuff, with spine loading, I don't know what working stuff means. With spine loading, you shouldn't feel pain. Like, it shouldn't be painful. You shouldn't be feeling some numbness or tingling stuff. You know, you shouldn't be having anything other than it should feel like the next day you did like your legs do with the leg workout. And your goal isn't to make yourself feel like that all the time, right? Like in strength training, if you're sore all the time, you are pushing too much and you're not recovering enough. So you need to check all those recovery factors that we talked about earlier, but with the spine, it's the same thing. So there you go. That's the spine episode. I'm just kidding. But,
I mean, there's still a good amount to cover. I would say outside of like spine cars and learning how to control your body and building awareness, there's a lot that you would benefit from a core stability standpoint,
so
which we have,
abdominal pressure,
which we have a whole podcast episode on. So if you haven't listened to that one, definitely check that one out.
Yeah, I would say the other thing is, how often is your spine doing the work for somebody else? What I mean by that is, when we work with people, I will try to go through as much of an assessment as I can, depending on what their goals are, what they want to do. We always start with the spine, but I will almost always try to at least get some hips, because they're so closely related to the spine. And if your hips don't have a good amount of flexibility and control or strength, you're going to use your spine to get something done, because our bodies are really fucking great at accomplishing a task that we ask them, whether or not it's in the way that we want it to. And if your spine is constantly doing the work for your hips and your shoulders and your shoulder blades and even your upper back, it's no wonder that it gets irritated, just like the group project analogy I gave at the very beginning. Movement is that way too. And a lot of times when I assess people, we'll look at shoulder blade cars, and guess what I see? Spine extension. We'll look at shoulder cars in general, the glenohumeral cars, and guess what I see? Spine extension and rotation. We'll do hip cars. Guess what I see? Spine everything, and especially spine extension a lot every time we do a hip car. So if you're usually with any sort of pain or tightness, we need to make sure that your painful area or your spine, if that's what it is, your low back, has a high threshold to pain, so we usually have to load it. And then we also have to make sure we're dissipating forces elsewhere so it's not getting too much load through it. So that's kind of the two sides of what we usually have to do.
Yeah. Can you move your spine when you want to move it? And can you keep your spine from moving, or stable, whatever you want to call it, when you're asking another body part to move?
Yes. And also, does your spine have the capacity to take on a little bit more load when it does compensate for something else? Because you want a buffer, right? You're not going to ever perfect your movement. There's going to be times when you need to use your hip and your spine together for certain movements. We usually do that with our bodies. That's movement is in general is usually a bit of movement from everything. So it's not that we just only want to be this perfect movement person all the time. It's just we want to make sure the parts work really well by themselves and that they have the tissue capacity to work together and dissipate those forces without putting too much load through the area that it's not prepared for. So we always will look at hip mobility, and I usually will try to look at shoulder and scapula, but most of the time, depending on the person, we prioritize hip stuff first. And we have a whole hip podcast episode about this, but if you don't have hip space, your hip is kind of like a fused joint. It's no longer a mobile joint anymore. So anytime you do any movement with your hip, you're essentially going to be having the back joint in. And
movement's got to come from somewhere.
Yeah, movement will come from somewhere as much as it can. Your body's just trying to do the best it can with what you're asking of it. And that's what's cool about our bodies. And if we weren't able to do that, if we weren't able to compensate, we just wouldn't be able to do anything. I know that we kind of even demonize, I don't want to say demonize, but talk about compensations is not ideal, but in reality, they're actually an evolutionary advantage because they help us get things done, and our bodies can adapt really fucking well, and they don't need to be perfect. Because if you've seen anybody who has a really crooked spine, like scoliosis, if you've seen anybody who's been born with any sort of different disability, like cerebral palsy, for example, some of those people will have a lot of changes in their bodies, and we may, to a movement person, would be like, oh, they're so stiff, they need to stretch this. But sometimes just making a small change is all that they need, because our bodies, and those people specifically, have had that issue for so long, their body's adapted to it. And that's all I want you to really think about here, is that we're not looking for perfect. We're just looking for a little bit better. And then let's make sure we're managing the volume. So yeah, I think that was my tangent for that. I kind of went off on a little other tangent from there, but we really want to go back. I want to go back to, if you are going to be an adult who is going to join a league of some sort, or you're going to get into a fitness routine, I just want to remind you that we might need to make sure that your body's prepared for it. So if you're going to start up a fitness routine like CrossFit or Orange Theory, or you're going to pick up running again because you signed up for a marathon or some sort of race, let's make sure that you're not jumping in from doing nothing, maybe you're a little active with your job or your kids, but doing no focused training or exercise for 5 or 10 years or more, even 2 years. Let's not jump from that to lifting or doing CrossFit or Orange Theory 5 days a week.
Yeah, we don't need to overcomplicate all of this movement stuff and be like, oh, if you're going to join a rec league, you need to get your full body assessed to make sure you have all of these prerequisites to do your one thing. No, we don't need to do that. That'd be maybe in an ideal world.
But that's also putting a barrier
between
people getting active. And really the most important thing is that you're exercising. Yeah. But it's can you exercise at an intensity where you're not destroying yourself?
Yeah,
or
just slowly get into it. Yeah. Just use a little bit of common sense, that if you went from
I don't even think it's common sense, but it's logic.
Okay, logic. Yeah, don't go from nothing to I'm doing this thing 5-6 days a week.
Yes. And at a max intensity, right? Yeah. Maybe you can go to Orange, because I'm picking Orange Theory and CrossFit because they're usually high intensity type of things. And our tissues are just not going to be prepared for that if we haven't been training them, which is why general strength training by itself is important. But the reason that I'm bringing this up in this podcast is because even general strength training is not addressing spine stuff. It's getting there, because we're still loading the spine, and even when you think you're neutral, you're still flexing it, right? We're still getting there, but it's still not loading your spine specifically and training your spine specifically. So I feel like we could go on a tangent a lot and talk about, I wish I saw more mobility in strength training and all of those things. And I do to an extent, but I feel this way specifically about the spine the most, because you're getting quite a bit of range of motion, like movement type related stuff in your general lifts. If you're kind of creating a good strength program, you're getting majority of it. And then if you just throw cars in there, you're doing a lot of really good stuff. And maybe there's a few things you need to do to address your deficits that you'd find in an assessment. But like, I would say the majority, the most important thing that you could do with cars and like traditional lifting to prepare for whatever it is you want to do activity wise, like a couple times a week, is specific spine exercises, like spine loading specifically.
Yeah, I'm thinking of like fitness, and I'm thinking all of these like accessory things that people would think that is mobility, and we could argue, is it mobility or not? That's a whole nother conversation, but they're adding like accessory work in for specific joints. But when it comes to accessory work for the spine, most of the time it's like anti-movement stuff.
Yeah, and we might start there, by the way. You might want to start there to introduce load, get them awareness, but we don't end there.
Yeah, we need to get the spine to move, and it can be something as simple as just doing spine cars.
Yeah, and then progressing from there. Remember, like, if you're going to want to do, I'm trying to think of specific movements, but if you're going to want to do things that involve a lot of load to your back, like, honestly, bending over and picking kids up is quite a bit of load. So let's make sure you're bending over and picking up something heavy. And a deadlift is really good for that. But let's just add a little bit more of like, can you control your spine? Can you get your spine involved?
Can you do it outside of neutral?
Can we do low levels of weight outside of neutral? And I don't mean starting that way, right? We'll go back to that a lot, but I want to progressively overload, and I want people to lift things in not perfect form, because life is not in perfect form.
We don't want you to have to worry about having perfect form of just putting your weights back on the rack.
Yeah. And I see this so much.
It just perpetuates this neutral spine thing.
Right, and that perpetuates fear. So I understand the idea behind, make sure that when you put your weights back, you keep your form. It's another rep in your lifts, which is maybe helpful if it hurts to get out of a position, right? So temporarily we might want to worry about that if it hurts, because every time you kind of go into a thing that hurts, sometimes it can become more sensitive. You're not doing more damage, it just sensitizes it. But like, we don't want to perpetuate that you need every time you lift anything to be in this perfect position, because guess what? There is no such thing. The only bad position, like Ryan has already said, is the one you're not prepared for. And if you constantly never prepare your body for any other position than the one that you lift in, you're only prepared in that position. And when life puts you in a different position, that's when shit hits the fan. So, and you can't be prepared for everything in life. But if you can expose yourself to as many options as possible and load yourself in many options as possible, you sure can mitigate injuries, which just means when they happen, they're going to be less often, they're going to be less severe, they're going to have a faster recovery time. And that's what mitigating injuries is, and that's why we don't prevent them, and that's what we're doing with a lot of the concepts that we talk about. Mm-hmm. So I feel like that's really all the spine stuff that you need to know. Like, I know we kind of make things complicated sometimes in the movement world, but that's really as simple as it is. Like, think about your spine. Make sure you're moving your spine. Don't be afraid to go outside of neutral. Make sure we're loading it slowly. If you're in back pain, we do have to get a little bit more complicated, because we're like...
But that's very nuanced and specific to that individual. Yes. So it's like hard for us to... Because we could be here for hours talking about individual cases and options. Yeah, but...
Because low back, like, there's a lot of structures in your low back. There's a lot of structures. There's a lot of different movements. And some people with low back pain, they feel better with flexion. So they feel better when we flex. Some people feel better with extension. Some people feel better only in neutral. Some people just need to move. Like, I just gave a few examples. So everybody's different, and we can't fix that or figure that out for you. A lot of what we have to do is figure out what's painful and how can we make sure you're not sensitizing this. And so we might tell them, let's let's do a movement this way temporarily so that we can let it calm down. So the ultimate goal in rehab is calm shit down, figure out what's bothering you, figure out if it's because your hip isn't working as much and your back is now having to do this movement and compensating specifically for it. Your stress, your sleep, all of that matter. And then while we're calming shit down, let's restore some of the things that may likely be contributing to it. We can never say for sure because our body's fucking complicated and that's just the bottom line. But we can manage that. And so calm shit down, build shit back up, and there you go. That's what we do.
Mic drop. End of the podcast.
Yeah, I think that's kind of where I'd like to end the podcast. Honestly, Do you have anything you'd like to add from that?
No, I mean, we already talked about it. All the other stuff, it's like in other episodes. Like,
yeah.
Do your due diligence. Listen to the stress and pain episodes if you have low back pain, so you understand how that affects your current pain experience. Listen to the core stability episodes, see how that can affect and maybe help with some of your lower back stuff. Listen to the hip episode, and then listen to this, and remember that you should eventually get into some spine training and spine movement stuff.
And you should not be pushing through your pain, which is what I kept saying in the
It's
beginning.
not a no pain, no gain thing.
It's not. And that's what I think most people have a struggle with, and that's a fitness mentality that's perpetuated. And I actually want you to feel as little pain as possible when we're doing any sort of exercises. My goal is to not push into pain almost ever as much as I can. In some people, when they're oversensitive, we will if it's been chronic for a while, but majority of the time, no.
Yeah, the majority of the time we're just finding Jen's secretly cringing right now because she's saying majority so often. But we try to find exercises and whatnot that are hard. So like, what's the hardest thing that you can do well and that's not painful?
Yep. And then
that should be your goal too from a training perspective.
Yeah. So that's the thing that I want you to know is that we're saying all these things we want you to do, but again, if you're pushing through pain and they all hurt, that's where you probably need to work with somebody to figure out, okay, so all of these hurt, let's modify. And I've had to do that. Not all of my patients, even low back people, start out with spine cars or spine segmentation. I actually have a person who's working on just hinge point training, which is where I'm having them isolate one segment at a time, just moving instead of doing like full spine car segmentation because it hurts her back or flares up her symptoms. And so that's just like an example that sometimes cars aren't even appropriate for everybody, but pain-free cars are always, so you can always start there.
Yeah, and I'd argue that hinge point training is still a variation of a car.
It is.
It just takes professional guidance and whatnot to help you determine what you need to do.
Mm-hmm. Yeah, and where you think you're moving, you might not be, so that's why sometimes it takes an assessment.
For sure.
So, all right, well, that was a great podcast. Hopefully you learned something. If you loved it, give us a review if you already have. Much appreciated.
If you want to kick me off, let me know now before we do too many of these.
No, Ryan is not allowed to be kicked off. I think he's too helpful. So I do want to tell you, if there is somebody who you know suffering from some low back tightness or stiffness or anything like that, send them this episode. I'm sure they may appreciate it because this is information I wish that I had access to when I was dealing with my low back stuff. So that way we aren't relying on all the medications and epidurals or whatever it is, injections that we're doing that aren't really ever fixing the problem and building spine resilience so we're mitigating injuries in the future because temporary things might feel good in the beginning but not always in the end. So,
and again, if you've gone through therapy and whatnot or rehab and you feel that you've failed or whatever, like it's more likely that the therapy or the exercise failed you because it wasn't the right thing that you needed. So don't give up. Yep. You haven't failed. You still have hope. You have other options.
I like Ryan's pep talks at the end of these. They're so good.
It's important to remember. I've been there.
Yeah, for sure. So I think that was a great way to end it. So we will see you in the next podcast.